We're going to transition into discussion on advising. Adam Nicholson is getting in later today, I think. He's at Wisconsin, one of the assistant directors of med student education. This part is relatively quick. There's a few sort of key points to bring up. And probably the whole crux of all of this is having a system set up where you have good communication with your students who are applying into emergency medicine. And so part of having good advising is having dedicated advising sessions, both formal group sessions and then also the ability to have one-on-one sessions with students who are applying into emergency medicine. And we have multiple sessions over the course of the year. So at Wisconsin, they have a beginning session in January for students who will be applying that upcoming fall, and make sure that they have identified all of the people who are planning to apply to emergency medicine, and then before they do rotations, if you can target them at that time point, which for their program works in January, they will ask sort of standard intake questions. They will review how things are going during the rotation, and then they will meet with these students again post-rotation and then pre-submission of their ERAS application. At Michigan, we have advisors who recommend that the students, if they're thinking about EM, reach out much earlier. So sometimes we get M1s and M2s who reach out wanting to meet and at least talk about it. But then we make a dedicated effort as well during the fourth year to reach out and identify students who are planning on applying, make sure that we have them on our radar list, and then we generate again, like a Google Drive document that's shared where we put down all the sort of prospective potential applicants and the information we have on them. And then every time we meet with them, we mark down when we met with them and what we talked about during that meeting. And so there's a few slides that essentially say advising can be challenging. Everybody has different backgrounds and needs. You can sometimes develop templates, and sometimes there are individual characteristics you have to pull forward that may not fit a template. The average student can be challenging, as we sort of talked about with SLOE writing. And so we want to gather sort of as much objective information as we can about all of our students in terms of things that might matter of the objective level to a program that's looking at applicants. So STEP scores, if those are relevant, clerkship grades, research publications, and other things they've done. But then also taking the time to meet with the student and get those non-objective factors that may contribute to the SLOE you can write for them, or the narrative you can help the student put forward in their application, in addition to just their grades by themselves. Below average students, so this can be challenging because as you mentioned, the positive feedback is easy, negative feedback can be challenging, but we do just want to emphasize it's really important to have appropriate expectation setting with all of your students, including your below average students. And that might mean difficult conversations such as you may want to consider applying to other fields. Now, granted, in the setting of last year with the unmatched spots, maybe that feedback is not the same this upcoming year, but in general, the concept is the same, which is the expectation setting about how they will do in this field based on their information so far, and what we think they need to do to sort of improve their candidacy, but also their approach to medicine so that they'll be successful residents. This came up in the SLOE part as well, so professionalism concerns. If things come up and you see them, it's better, as you mentioned, to bring this up earlier when they come up, rather than having them find out when you're writing the SLOE 6 months after their clerkship that there was a concern a long time ago. So if something comes up, be proactive about reaching out and then giving them a chance to show improvement, which you may be able to show in their application. I really covered a lot of these ideas at the last discussion. Strong work. And so it's a brief section, but we do want to sort of give you the chance to ask questions about how it's structured, if there's questions on that, or any particular questions you might have on advising. But otherwise, this is an area I think people are generally pretty comfortable with sort of the key points being have a structure in place at your institution for reaching out to the students, and then try to meet before their clerkship, during clerkship, and after clerkship before they submit their application. Have the difficult conversations early, do expectation setting, and figure out what are the characteristics of your applicant that you want to help them put forward when they're applying.